What is St. Luke's doing? St. Luke's aims to do nothing short of transforming healthcare. And why is really two reasons. Well, actually, you can boil it down to one reason. We have a value problem with healthcare in America, which is quality divided by cost. And if we start with the cost, the United States is in trouble. The net present value of our debt is now in excess of $60 trillion. Some healthcare experts say it's as high as $80 trillion. That number is more than the GDP of the planet. It's more than $200,000 for every man, woman, and child in the country. And two-thirds of that number is made up of the Medicare shortfall, Part A, B, and D, going forward into the future. So we have a huge financial problem that we have to fix. And if we don't, healthcare is going to consume literally every tax dollar we spend. And if that occurs, you think about, well, what's going to happen to our roads? What's going to happen to our schools? What's going to happen to national defense? I mean, it's actually that pressing. The second part of the value equation, though, is the quality piece. And there, too, there is much work to be done in healthcare. First off, we're not even safe as an industry. We don't even come close to approaching the safety of commercial airlines. Our safety record is more like the safety record of baggage handling in the airlines. And you think about that with your life or the life of a loved one, and that's unacceptable. As evidence for that, I would throw out that, never events like wrong site surgery occur around 40 times a week in the United States, according to the Joint Commission. I would also, throw out that, we estimate that up to 100,000 people die every year due to medical errors. It's the fourth leading cause of death in America. So we're not safe. We don't follow our own recipes for, perfect care. Perfect care means for certain disease states, there are certain therapeutic measures that should be implemented to provide evidence-based care for the patient. And even when we know those recipes really well, we don't follow them according to the medical literature nearly as often as we should. And then if you just look at safety, processes, and then look at outcomes. And what kind of outcomes do we get? For older folks in America, healthy life expectancy after age 60 is down around 17 or 18 in the world, despite the fact that we are the #1 spender in the world. We outspend the rest of the developed world 2 to 1 on healthcare. So that's why we aim to transform healthcare, is because we've got this problem with value. The how we plan to do that is through transforming the clinical model and the payment model and achieving the triple aim.